Plantar reflex. Now let us look at the plantar reflex, an important component of the neurological examination. So the plantar response gives us useful information about the integrity of the corticospinal or pyramidal pathway. So it gives us information about the integrity of the corticospinal or pyramidal pathway. So to elicit the response, the patient should be lying supine and relaxed. How should the patient be placed? Lying supine and relaxed. We use a blunt, non-injurious object like a key and stimulate the sole beginning near the heel. So you can see from this picture. So we use a blunt non-injurious object and we stimulate the sole beginning near the heel. We move along the lateral border towards a little toe. So along the lateral border we are moving towards the little toe and then we are curving medially across the forefoot towards the great toe. So curving medially forefoot towards the great toe. The stimulus should be firm enough to produce a response, but it should not be excessively painful. How should the stimulus be? It should be firm enough. Should it be painful? No, it should not be excessively painful. In a normal adult, the great toe flexes or plantar flexes. What happens in a normal patient? The great toe, it will flex or it plantar flexes. The other toes may also flex. So this is called a flexor plantar response. So in second normal response, you can see that great toe flexes, other toes also usually flex. The important abnormal response is the extensor plantar response or Babinski sign. What is the important abnormal response? It is the extensor plantar response or Babinski sign. So in third it is abnormal response. You can see the abnormal response, extensor plantar response. Here the great toe dorsiflexes or extends and the other toes may fan or abduct. So what happens in this? The great toe dorsiflexes or it extends and the other toes may fan or abduct. So in an adult, a reproducible extensor plantar response suggests dysfunction of the corticospinal tract and therefore an upper motor neuron lesion. So in an adult, a reproducible extensor plantar response. So this suggests dysfunction of the corticospinal tract and therefore an upper motor neuron lesion. So one important practical point is not to mistake withdrawal for Babinski. What is the important practical point? Not to mistake withdrawal for Babinski. A painful stimulus can cause flexion or withdrawal of the entire leg and this may be misleading. Okay, a painful stimulus, it can cause flexion or withdrawal of the entire leg and this may be misleading. We should therefore observe the great toe carefully and repeat the examination if necessary. So we should therefore observe the great toe carefully and repeat the examination if necessary. For examination, remember one simple rule. So in an adult, great toe down is a flexor response. Great toe up when reproducible suggests an upper motor neuron lesion. So what does it suggest when great toe is up? It suggests an upper motor neuron lesion. Then first, the reflex is commonly localized to the S1 to S2 spinal segments with the tibial nerve playing the major role in the reflex pathway. What is the nerve playing the major role? Tibial nerve. So the normal adult response is a flexor plantar response with downward movement of the great toe. In contrast, reproducible extension of the great toe with or without fanning of the other toes is an extensor plantar response or Babinski sign. Why this is important? Because an extensor plantar response in an adult, it suggests a corticospinal dysfunction. So where do you see this corticospinal dysfunction? In conditions such as stroke, spinal cord lesions, multiple sclerosis and any other lesion affecting the corticospinal pathway. So what are the conditions? Stroke, spinal cord lesions, multiple sclerosis and other lesions affecting the corticospinal pathway. So when examining a patient, we should always compare both sides and avoid excessive pain. What should be done? We should avoid excessive pain and we should compare both the sides. So a noxious stimulus can produce withdrawal of the entire limb and can make interpretation difficult. So a noxious stimulus, so this can produce withdrawal of the entire limb and can make interpretation difficult. The key is to look specifically at the great toe. So a genuine Babinski's response should be reproducible and should represent true great toe extension rather than a non-specific withdrawal movement. So a genuine Babinski's response, it should be reproducible and should represent true great toe extension rather than a non-specific withdrawal movement. There is also an important age-related point. So an extensor plantar response is physiological in infants and young children because the corticospinal pathways are still maturing. So extensor plantar response is in infants and young children, it is physiological because the corticospinal pathways are still maturing. It usually disappears by about 12 to 24 months. So when does it disappear? By about 12 to 24 months. So the final clinical pearl is very simple. In an adult, a reproducible upgoing great toe is an extensor plantar response and should make us think of an upper motor neuron or corticospinal tract lesion. So what is the final clinical pearl? In an adult, a reproducible upgoing great toe is an extensor plantar response and should make us think of an upper motor neuron or corticospinal tract lesion. So what is the summary? The plantar reflex is elicited by stroking the lateral border of the sole from the heel towards the little toe and then medially across the forefoot. Flexion of the great toe is the normal flexor response. Reproducible extension of the great toe with or without fanning of the other toes is an extensor plantar or Babinski response and suggests corticospinal tract dysfunction in an adult. Withdrawal of the whole leg should not be mistaken for Babinski's. Thank you.